Hi Hannah, how are you doing today?
I'm doing okay. How are you?
I'm doing well, thanks for asking.
Good.
So my name is Megan and I'll be conducting your intake interview today. I'm going to go through the informed consent really quickly, ask you some questions just so I can get to know you a little better, and we can finish with any questions that you have for me. I'll be taking notes with my laptop today, is that okay with you?
Yeah, that's fine.
Okay. So what you signed out in the lobby was informed consent, which basically just explains your rights and responsibilities as a client. It gives you the risks, the benefits, and informs you of confidentiality concerning our sessions. There are a couple reasons that may require me to break this confidentiality, and that would be if you might be harming yourself or you pose a threat to others. I may also have to send notes to your insurance in order for these sessions to be covered.
Okay.
Does that all make sense?
Mm-hmm.
Yeah. Okay. And so in any other circumstances, everything said in this room will be kept in this room. I just want you to know that like you can trust me completely, and that everything said here is completely confidential, and everything will be kept private. So does that sound okay to you?
Mm-hmm. Yeah.
Okay. So let's get started with some pretty basic questions. What brought you here today?
So I've been experiencing some OCD-like symptoms. I think that's kind of rooted in anxiety. So mostly when I come home, I just feel the need to clean everything. I just feel like there's germs everywhere and everything's dirty, and I just have to clean all the time when I'm home.
Okay, so it sounds like some of these anxiety symptoms are making you clean a lot, and then does it affect your everyday life?
Yeah, I would say so. Like, I can't come home and just relax. I just have to clean. I can't do anything else but clean when I'm at home.
Okay, so that's pretty much all you think about when you're home?
Yeah, basically.
Okay. Can you tell me just a little bit more about yourself? What do you do? Like what some of your hobbies are?
Yeah, so I am a college student right now. I have a job that I work a couple days a week, and for fun I go and work out and spend time with my family and friends.
Okay, and so you mentioned your family and friends.
Mm-hmm.
So how would you say your relationships are with them?
Really positive. My family is really supportive and loving, and yeah.
Oh, good. So it sounds like you have a really good support system then.
Yeah, my friends are really supportive too.
Oh, good. So do your parents live in town?
No, they live about 3 hours away, so I see them maybe once a month or so, but I talk to them often.
Okay, that's good.
Yeah.
And so they know about you coming to therapy, and they know about kind of some of your anxiety symptoms you're experiencing?
Yeah, yep.
Okay. And so how long have you been experiencing these symptoms?
I guess anxiety for about 4 years or so, and then these OCD symptoms or behaviors, those started a couple months ago when I moved into my new apartment.
Okay, so you moved into your new apartment. Why did you move, or what?
To come to college.
Come to college. Okay.
Yeah.
Okay, very cool. So do you live with anyone?
Yeah, I have 2 roommates that I live with, so.
Okay. Do you think that this behavior kind of affects your relationships with them, or with your friends, family?
It might affect my relationship with my roommates, I guess. We're not super close or best friends or anything, but we get along okay. I don't think it affects my relationship with my family or closer friends, though.
Okay, well that's good.
Yeah.
Sounds like they're going to be there for you no matter what. So
yeah.
That's a good thing to have. So kind of already talked about your friendships, your family. Do you have any romantic relationships going on right now?
Not right now.
Okay. So what are some things you like to do in your free time?
I definitely like to go work out, go to the gym. That's fun. My family spends a lot of time together, just enjoying each other's company, so.
That's good.
Yeah.
So, excuse me. So no romantic relationships. Do you feel like in your free time those symptoms go away, or do they worsen when you leave?
Like going and doing other things helps me get my mind off of it, and I don't really think about the cleaning or the germs or the dirtiness of my apartment. But when I get home, that's when it flares up.
Okay. So have you seen a therapist before now?
A few years ago when I wasn't in college yet, just for a little bit, just for anxiety, but nothing for these OCD symptoms.
Okay. And so you feel like your anxiety is worsened, or just the OCD symptoms?
I think the anxiety is worsened, and then that brought about the OCD behaviors.
Okay. So it sounds like this is kind of impacting you like on a pretty serious level, would you say so?
Every day, I would think.
Every day?
Yeah.
Okay, so it's pretty severe.
Yeah.
It seems like it's kind of just affecting you in your home life then.
Mm-hmm.
Okay. So maybe moving away from your family maybe had something to do with that?
That could be.
Could be? Okay. So what are some of the symptoms that like happen to you physically when you feel anxious or you feel the need to clean?
Mm-hmm. Well, I guess my mind just races and my heart feels like it's beating out of my chest. Those are the two main things.
Okay, and just this like compulsive thinking that you have that you feel like you just have to, you can't control it.
Yeah.
Okay.
Yeah.
Okay. So we kind of talked about a little bit of the negative things going on in your life, so I just want to touch on some of the positive things. So what do you think some of your strengths are, or some positives that are going on in your life right now?
Well, I feel like I'm successful in school and I do well at work, so those are good things, and my family and my friends bring me joy, and they're positive people in my life. So overall, I think everything's pretty good except for when I go home.
Okay, so those anxiety symptoms are really just like taking a toll on you.
Yeah.
Okay. So do you have religion in your life? Is that something that's important to you?
Yeah, I go to church pretty on the regular.
Okay, so that seems like that's something that you can kind of like have there for you as a support as well if
for
needed.
sure.
So you've got your family, your friends, and your church as well. So you said you go to college, right? So so you just moved here, right? Is that what you said?
Yeah.
Okay. So you said you've been to therapy. Have you ever had any medication taken?
No medication.
Okay. And what about any substance use?
No, nothing
Okay.
severe.
And so why did your therapy stop? Or when you moved here, why did you not seek out?
I just didn't feel like I needed it until it just really affected me every day.
Okay. And does your family have a history of mental health?
I think my mom has some depression, but other than that, not really.
Okay. And so your previous mental health history is basically just the anxiety you experienced?
Yeah.
Okay.
Yeah.
And that you went to see a therapist while you were in high school? Okay. And so you said you've never used substances, you've never had any medications. Have you ever had any trouble with the law?
No.
Okay, that may seem like a silly question, but I've got to ask it. So.
Yeah.
So what are you looking to get out of therapy?
Just some like coping methods and just ways to just stop these impulsive, obsessive behaviors. I just don't want to think about it anymore.
Okay. Okay, so it sounds like you just really need help with kind of controlling those thoughts and those symptoms.
Yeah.
So what is this is kind of similar, but what like goal would you like to like come out of therapy?
Yeah. Just to get better. I'm determined to get better.
Okay. Yeah, and it sounds like with your strengths, your determination, your hard working, it sounds like those are like really good traits to have.
Yeah.
And, I think that will be really beneficial in therapy. So, Okay, so now I'm going to ask you a series of questions that may seem kind of weird, but they're just kind of routine questions that I have to ask. So, would you state your full name, please?
Hannah Pesic,
And your date of birth?
January 31st, 1998.
Okay, and where are we?
We are in Bismarck at your office.
Okay, and why are we here today?
We are here because I'm seeking out therapy.
And do you hear any voices at all that other than your own?
No.
Okay. And you mentioned that you've had anxiety symptoms before. Were you ever actually diagnosed with generalized anxiety disorder or OCD?
No, I don't think so. But
Okay.
I mean, I could be probably.
Okay. Okay. And are you open to any kind of therapy that we'll be doing?
Yeah, I'm open to whatever.
Open. Okay. Even if medication is needed, you would be open to that.
Yeah.
Okay.
Maybe as a last resort.
Okay, last resort. Well, we'll definitely keep that in mind, and we want you to be comfortable with anything that we're doing. So, well, I think that's all the information that I need from you. I'm just looking forward to continuing our sessions, and it was really nice to meet you. Is there any questions that you have for me, or anything that we haven't covered that you think we need to cover?
So if I don't see you in the week, how can I get a hold of you?
Okay, so you can always call the front desk and have them schedule an appointment for you.
Okay.
And you can probably schedule your appointments in advance. That way you don't have to worry about not seeing me for the week.
Okay.
So yeah, I would do that. I would go as soon as you leave here, schedule your weeks and your appointments in advance.
Okay.
So you don't even have to stress about that.
How many times a week can I see you?
I would say, I mean, usually once a week is pretty standard, but if you feel like you need to see me more, we can always talk about that.
Okay, that sounds good.
Yeah. So do you have any other questions for me?
I don't think so.
No? Okay. Well, it was great to meet you, and I'm looking forward to continuing our sessions.
Thank you.
Thanks.